Introduction: 10 hidden deficiencies every diabetic should fix immediately. If you've been doing everything right, taking your meds, watching your diet, checking your blood sugar, yet still feel tired, foggy, or frustrated that your glucose won't stabilize, you're not alone. Millions of diabetics are missing one silent factor that keeps their body from healing properly: micronutrient deficiencies. These are the vitamins and minerals your body needs to make insulin work, to repair your nerves, and to keep your energy up. But here's the shocking part: studies show that up to 80% of diabetics are deficient in at least 3 key nutrients, and they don't even know it. These hidden gaps quietly destroy your metabolism from the inside out, making every other effort less effective. Today I'll show you the 10 most critical deficiencies every diabetic must fix immediately, and how correcting them can lower your blood sugar, strengthen your nerves, and give you your energy back. Before we begin, comment reset below if you're ready to take control of your health again. And don't forget to subscribe to Dr. Adam Watanabe, your trusted daily source for science-backed diabetic nutrition that works in the real world. Let's begin. Vitamin D deficiency, the hidden hormone that controls your sugar. Most people think of vitamin D as the sun vitamin, but it's actually a hormone that directly affects how your body uses insulin. Low vitamin D makes your cells resistant to insulin, meaning even a healthy diet can't keep your glucose stable. In fact, studies show that diabetics with low vitamin D have 3 times the risk of nerve damage and heart disease. It also impacts your mood, immunity, and metabolism, which is why many diabetics feel tired, foggy, or depressed during winter months. Without enough vitamin D, your pancreas can't release insulin efficiently, and inflammation rises throughout your body. You can naturally boost vitamin D with 15 to 30 minutes of daily sunlight, or through foods like salmon, egg yolks, and fortified milk. But most people need 2,000–5,000 IU daily from supplements to maintain healthy levels, ideally as vitamin D3 with K2, which helps calcium go to your bones instead of your arteries. Comment D power if you're ready to take back your energy and stabilize your sugar naturally. Subscribe to Dr. Adam Watanabe, your trusted source for practical, science-based health strategies every diabetic should know. 2. Magnesium deficiency, the silent trigger behind sugar spikes. If your blood sugar keeps climbing even with medication and diet control, your problem might not be carbs, it might be magnesium deficiency. Magnesium is the mineral that makes insulin work properly. It helps glucose enter your cells and calms the nervous system, yet more than 70% of diabetics are deficient without realizing it. When your magnesium levels drop, insulin becomes less effective. That means your pancreas works overtime, leading to exhaustion and erratic glucose swings. Deficiency also causes cramps, insomnia, anxiety, and irregular heartbeat, but most people just ignore these as signs of aging. Processed foods, diuretics, and chronic stress drain magnesium daily. Without it, your muscles can't relax, your energy crashes, and your blood sugar becomes unpredictable. The best sources are pumpkin seeds, spinach, almonds, and dark chocolate. But for diabetics, magnesium glycinate or malate supplements 200 to 400 milligrams a day are ideal, gentle on the stomach, and easily absorbed. Comment Mag Reset if you're fixing your magnesium tonight. Subscribe to Dr. Adam Watanabe for daily science-backed guidance to restore balance and energy safely. 3. Vitamin C deficiency, why your blood sugar stays high. Most people think of vitamin C as just a cold remedy, but for diabetics, it's a powerful weapon against high blood sugar and oxidative stress. Vitamin C acts like a shield for your blood vessels, protecting them from the constant sugar damage that leads to neuropathy, kidney disease, and vision loss. What's shocking is that high glucose competes with vitamin C for entry into your cells, meaning the higher your blood sugar, the less vitamin C your body can use. This creates a cycle of inflammation, weak immunity, and poor healing. Deficiency signs include easy bruising, gum bleeding, slow wound healing, and frequent fatigue. Vitamin C also helps regenerate vitamin E, improves collagen formation for skin and arteries, and enhances insulin sensitivity. The best sources are bell peppers, citrus fruits, broccoli, and kiwi, but since diabetics often have absorption issues, liposomal vitamin C supplements are the most effective. Aim for 500–1,000 milligrams daily, ideally split into 2 doses. Comment C boot if you're taking control of your sugar health today. Subscribe to Dr. Adam Watanabe. Every video brings science-backed guidance to protect your nerves, heart, and energy. No omega-3 deficiency, the missing shield against inflammation and heart disease. If you're diabetic, your biggest silent enemy isn't sugar, it's inflammation. And one of the strongest natural protectors against it is omega-3 fatty acids. These healthy fats keep your arteries flexible, reduce insulin resistance, and protect your brain. Yet most diabetics consume almost 20 times more omega-6 than omega-3, throwing the body into a constant inflammatory state. Low omega-3 levels are linked to high triglycerides, fatty liver, brain fog, and poor circulation, conditions that accelerate every diabetic complication. The scary part, you may not feel any symptoms until serious damage begins. The best sources are wild-caught salmon, sardines, mackerel, chia seeds, and flaxseed oil. But for most people, food alone isn't enough. Fish oil supplements, EPA plus DHA, are essential to restore the right balance. Aim for 1,000 to 2,000 milligrams of combined EPA-DHA daily. Omega-3s also strengthen cell membranes, making your insulin receptors more responsive. That means smoother blood sugar control and better energy throughout the day. Comment Omega Fix if you're adding this to your diet today. Subscribe to Dr. Adam Watanabe, your daily guide to balancing inflammation, protecting your heart, and living longer with diabetes. Heist 5. Potassium deficiency, the hidden driver of high blood pressure. Many diabetics focus on sugar but overlook potassium, a key mineral that keeps your heart, nerves, and muscles working properly. When potassium levels drop, your blood vessels tighten and your blood pressure rises, a dangerous combination for anyone with diabetes. But here's the kicker. Some diabetic medications, especially diuretics, literally flush potassium out of your body. Symptoms of low potassium include muscle weakness, irregular heartbeat, fatigue, and constant thirst. Most people don't connect these signs to mineral loss, but it's one of the earliest warnings of electrolyte imbalance. Potassium also helps regulate how your body stores glucose. Without it, your cells become resistant to insulin, driving your blood sugar even higher. Foods like avocados, spinach, beans, sweet potatoes, and bananas are excellent sources, but avoid overdoing fruit if your blood sugar is unstable. Supplements should only be taken under medical supervision, since too much potassium can strain your heart. Comment balance if you'd like a video on how to naturally restore potassium without raising blood sugar. Subscribe to Dr. Adam Watanabe for more natural ways to stabilize glucose and protect your heart every day. 6. Zinc deficiency. Why your wounds take forever to heal. If your cuts or sores take too long to close, or if infections seem to return again and again, you might be missing zinc, one of the most underestimated minerals in diabetic health. Zinc helps your body repair tissues, fight bacteria, and regulate insulin. But here's what many diabetics don't know. High blood sugar depletes zinc through urine, leaving your immune system weaker and your skin slower to heal. Zinc also plays a crucial role in how your pancreas stores and releases insulin. Without it, your blood sugar fluctuates wildly, even when your diet seems under control. This deficiency also increases inflammation, weakens taste and smell, and worsens fatigue. In fact, studies show that up to 60% of diabetics have low zinc levels, especially those with frequent infections or ulcers. The best food sources are oysters, pumpkin seeds, beef, and chickpeas. For supplementation, zinc picolinate or zinc leuconate, 15 to 30 mg day are the most absorbable forms. Comment zinc reset. If you've ever noticed slow healing or chronic fatigue, it might not be age, it might be deficiency. Subscribe to Dr. Adam Watanabe for daily science-backed solutions that help your body heal faster and naturally. 7. Chromium deficiency, the missing link in blood sugar control. Most people have never heard of chromium, yet it plays a direct role in how your body uses insulin. Chromium acts like a key that helps insulin unlock your cells so glucose can enter. Without it, even normal insulin levels won't work effectively. Your blood sugar stays high, and your pancreas keeps producing more insulin, eventually leading to burnout. Unfortunately, diets high in refined carbs and processed foods strip chromium from the body. Add years of diabetes and medication use, and deficiency becomes almost inevitable. Signs include sugar cravings, fatigue after meals, and blurred vision. Studies show chromium picolinate can improve insulin sensitivity by up to 30% in people with type 2 diabetes. To restore levels naturally, include broccoli, eggs, oats, and green beans in your meals. Supplements of 200-400 mg daily can further stabilize glucose and reduce cravings. Comment chromium balance if you want me to make a full video on this mineral. It's a game changer. Subscribe to Dr. Adam Watanabe for more practical tips to improve insulin function naturally. 8. Vitamin B12 deficiency, the hidden cause of nerve pain and fatigue. If you've been feeling numbness in your feet, burning in your hands, or constant exhaustion, it might not be just diabetes. It could be a vitamin B12 deficiency, one of the most common yet overlooked problems among diabetics, especially those taking metformin. That medication, while effective for blood sugar, blocks your body's ability to absorb B12 from food. Over time, this leads to nerve damage, weakness, memory problems, and depression. Vitamin B12 is essential for nerve insulation, red blood cell formation, and brain health. When levels drop, your nerves begin to short circuit, creating the painful tingling many diabetics mistake for irreversible neuropathy. But it's not always permanent. Restoring B12 can help regenerate nerve fibers and improve energy and mood. Natural sources like eggs, salmon, sardines, and beef liver are excellent, but most diabetics need a methylcobalamin supplement, which is the most bioavailable form. Take it sublingually under the tongue for better absorption. Comment B12 fix if you've ever felt that strange tingling or fatigue that just won't go away. Subscribe to Dr. Adam Watanabe for science-based ways to protect your nerves and regain your strength naturally. Vitamin D deficiency, the hormone you didn't know you needed. Vitamin D isn't just a vitamin, it's a hormone your body needs to control insulin, immunity, and inflammation. Yet almost 70% of diabetics are deficient. When your vitamin D levels are low, your pancreas becomes less sensitive to glucose, and your cells resist insulin more aggressively. That means higher blood sugar, more inflammation, and faster fatigue. Deficiency can also cause bone pain, mood swings, depression, and even nerve damage over time. But here's the good news. Restoring vitamin D is simple and powerful. Spending 20 minutes in sunlight daily helps, but for most diabetics that's not enough. You need a vitamin D3 supplement 5,000 to 10,000 IU daily, combined with vitamin K2 to make sure calcium ends up in your bones, not your arteries. Low vitamin D also weakens your immune system, leaving you more vulnerable to infections that slow healing and worsen diabetic complications. Comment D-Boot if you're ready to take control of your vitamin D levels today. Subscribe to Dr. Adam Watanabe. We reveal simple, science-backed fixes that make a real difference in your diabetic health. Magnesium deficiency, the silent trigger behind fatigue and cramps. One of the most common and most ignored deficiencies in diabetics is magnesium. This mineral is behind over 300 biochemical reactions in your body, including blood sugar control, muscle function, and energy production. When you don't have enough magnesium, your body struggles to move glucose from your blood into your cells. That's why low magnesium and high blood sugar often go hand in hand. You might notice muscle cramps at night, tingling in your feet, or constant fatigue that no amount of sleep fixes. That's your body begging for magnesium. It also affects your heart rhythm, your mood, and your ability to relax. Studies show that people with higher magnesium intake have up to 33% lower risk of developing type 2 diabetes. But here's the catch. Most diabetics lose magnesium through urine faster than they can replace it. High blood sugar literally flushes it out. To restore balance, eat more pumpkin seeds, spinach, almonds, and avocado, or take magnesium glycinate before bed for better absorption and relaxation. Comment magnesium reset if you're adding this to your routine tonight. Subscribe to Dr. Adam Watanabe for daily insights that help you stabilize glucose and rebuild your health naturally. Ending 10 hidden deficiencies every diabetic should fix immediately. Here's the truth. Diabetes management isn't just about avoiding sugar. It's about giving your body the raw materials it needs to function. When even one nutrient like magnesium, vitamin D, or zinc runs low, everything else begins to fall apart. Your insulin stops working, your nerves weaken, your metabolism slows, and fatigue takes over your life. But the good news is this, your body wants to heal. Once you give it what it's missing, you'll start noticing powerful changes. Better sleep, fewer sugar crashes, more energy, clearer thinking, and stronger immunity. Now it's your turn. Look back at this list and start by fixing just one deficiency today. Whether it's adding more leafy greens, a quality supplement, or spending 15 minutes in the sun, every small step counts. Comment below which deficiency do you think has been affecting you the most. And don't forget to hit subscribe because every day we uncover the hidden science behind diabetic health that your doctor never told you about. I'm Dr. Adam Watanabe and I'll see you in the next video.